More than 4.3 million Ohioans, about 37%, have received at least one shot of the COVID vaccine.
And doctors are now addressing concerns over COVID-19 vaccine side effects. Now, we've heard from viewers about their symptoms after receiving the vaccine. One woman tells us her husband came down with Bell's palsy shortly after. News 5's Clay Lepard has more.
Try to find something in common among 131 million people. It's not easy, but there is at least one. That's the number of Americans who have received at least one dose of the COVID-19 vaccine.
A third of the people will have about a 24-hour symptom complex, kind of fever, chills, malaise, and that just reflects their immune system. We're really not seeing more than that at this point.
Dr. Keith Armitage serves as an infectious disease specialist and medical director at university hospitals, and he keeps an eye on those vaccinated and the side effects that may pop up.
Side effects of the vaccine pale in comparison to the adverse effects or adverse consequences of getting coronavirus.
Some of those side effects of the vaccine continue to dominate the headlines, including the ongoing pause over the Johnson & Johnson vaccine after 6 reported cases of a rare type of blood clot.
And what's happening with Johnson & Johnson should reassure people that it's being constantly monitored.
One News 5 viewer recently reported that her husband suffered from Bell's palsy, where muscles in the face suddenly become weakened. In that case, after receiving a Johnson & Johnson vaccine. It's a concern that's appeared more than once over the past several months. In a Pfizer vaccine trial, which was submitted in December, 4 people experienced Bell's palsy. Those symptoms appeared 3, 9, 37, and 48 days after vaccination. However, the CDC's website points out that, quote, the Food and Drug Administration does not consider these to be more than the rate expected in the general population. They have not concluded these cases were caused by vaccination.
When you're vaccinating millions of people, there's going to be some clinical events that are random and unrelated in people who got the vaccine. The key is to monitor and see if there's, more of these events in the vaccine group than not vaccine group.
About 60% of the population nationwide still has not received any COVID-19 vaccine. Clay Lepard, News 5.